Women and girls from all over the world have the human right to choose whether and when to become pregnant. However, there is a present number of 214 million women of reproductive age in developing countries who wish to prevent pregnancy and are not using a modern contraceptive method. Promoting family planning through easy access to preferred contraceptive methods for women and couples in developing countries is fundamental in ensuring the well-being and autonomy of women while supporting the health and development of communities. An inequity exists when people are unfairly deprived of something they want or require to protect them from unwanted or undesirable condition. A quote from the WHO organization reads, "There is an unmet global need for contraception in developing countries, and to dismiss it is to accept it." We should not accept that in Africa, 1 in 26 women of reproductive age passes away from maternal cause in comparison to 1 in 9,400 in Europe. The differences in mortality and morbidity in relation to socioeconomic class constitute the inequity that the poor simply does not have the same access to life-saving and health-maintaining interventions as the rich, even if they aspire to the same healthy lives as those who are economically well off. So, on my vision board, you can see that the low-income families from the developing countries are off balance with the developed countries who already have all easy access to birth control methods and sex education. 94% of maternal mortality occurs in low-income and lower middle-income countries, while over 85% of maternal deaths come from impoverished communities in Africa and Asia. Women in less developed countries have an average many more pregnancies than women in developed countries. Plus, their lifetime risk of death due to pregnancy is much higher. In high-income countries, the possibilities are 1 in 5,400 versus 1 in 45 in low-income countries. The gap between the rich and the poor in regards to the use of contraception has persisted, and health disparities between them have remained a challenge. Oftentimes, women are susceptible to believing that the pill can cause infertility, so they opt out. This is due to a lack of availability and knowledge of contraception and family planning. Fewer than 1 in 10 women in the village of Turkana used a modern method of family planning. Unfortunately, this is an example of women all over the world in developing countries who are affected due to lack of available knowledge of methods of contraceptives. They are unaware that there are safe ways to prevent pregnancy. Setting up the foundation for a formal education for women who want to use contraceptives is essential if we want them and their child to succeed. Not providing education through family planning programs is an obvious manifestation of a much broader problem of a female deprivation, says worldbank.org. Increasing programs and services that increase educational opportunities for girls and women is one of the best prospects for cutting into this vicious cycle. Regardless of socioeconomic status, every woman should have the right to choose whether or not to become pregnant. Limiting the access to birth control contraceptives to women is not giving them an equal right to themselves or their body. Planned pregnancy allows women to better control their life trajectory and contributes to the future of a child's health and their development. Taking away this basic human right is degrading to women and deprives them of their personal autonomy. Regardless of social status, culture, or religion, a woman should be able to make her own decision apart from the government ruling when it comes to her body. Misinforming women about contraceptive methods can result in a higher risk for pregnancy, which many low-income couples or families cannot afford. Women specifically in third world developing countries are at a higher risk of danger in pregnancy because they are prone to diseases and STDs. So this is the third part of the vision board, where women in developing countries are more prone to getting diseases or STDs upon birth, such as malaria or some airborne diseases that cannot be stopped but can only be cured with a certain medicine, and some cannot afford it and much rather have saved themselves from the pregnancy. In many cases, a newborn child will come from poverty and faced with disease upon birth, cannot be treated, and will face death. In other cases, the child will survive and can continue to live deprived due to the low-income family of the mother The issue in the lack of contraceptives and family planning in developing countries is one more than many. Providing easy access to contraceptives can help avoid many issues that come with unwanted pregnancies and even maternal mortality. Promoting family planning through easy access to preferred contraceptive methods for women and couples in developing countries is fundamental in ensuring the well-being and autonomy of women while also supporting the health and development of communities. Doing so can give women the opportunity to make a better life for themselves and their families, serve justice to the future families and disenfranchised women of low-income communities, and ultimately give women full freedom to their bodies. Thank you.